Mr. President, I've had over 40 town hall-like meetings since the beginning of August, and I can say without hesitation that I have never used those meetings to try to focus on some of the hot-button issues that divide us in this country. On not one occasion have I tried to do that. I've tried to focus on the fundamentals of this health care bill. And Mr. President, way back when I began meeting with the distinguished chairman of the Finance Committee, which I greatly appreciated his desire to meet with me, and realized that Medicare may be a place where money will be taken to leverage a new entitlement. I began expressing my concerns about that. Later, I sent a letter to Majority Leader Reid, signed by 36 senators, talking about the fact that if Medicare monies were used to leverage a new entitlement, we could not support that effort. Mr. President, the reason I say this is that this is the same exact thing I have been saying about this bill from day one, before it was ever constructed. And so I'm very dismayed that we find ourselves here in December debating a bill that does exactly that. When I first came to this body, there was a lot of concern in this body about the solvency of Medicare. I think everyone here knows that the trustees have talked about the fact, have stated that in 2017, Medicare will be absolutely insolvent. Two senators from opposite sides of the aisle have tried to create legislation that would put in place a commission, 8 Republicans, 8 Democrats, to actually solve that issue, because we realize that we do not have the resources in Medicare to actually deal with the liabilities that we have with seniors all across this country. So, Mr. President, the fact that we are taking $464 billion in savings out of Medicare to leverage a new entitlement, to me, is totally irresponsible. The same thing I've been saying from day one. I'm dismayed that we in this body would consider kicking the can down the road, making sure that people of the generation of the many people that are helping us here on the floor today will be straddled with huge amounts of cost down the road that they will not able to deal with in a very responsible manner. So, Mr. President, I am very discouraged. The fact is that the other piece of this that is extremely troubling is that we all know we have the issue of SGR, the doc fix, which is a colloquial term to describe the fact that in a year after this bill passes, physicians across this country will be receiving a 23% cut for serving Medicare recipients. And I think that Medicare recipients understand what that means. It means that they're going to have less physicians to deal with the needs that they're going to have at that time. This bill, instead of dealing with that issue, deals with it for 1 year, Mr. President. And what that means is there's about $250 billion worth of expenses that are not being dealt with this Medicare savings. So let me walk through it one more time. We have a program that is insolvent. We have a program that cannot meet the needs of those people who have paid into this program for years and that many of us continue to pay into. This program is insolvent, and we're going to take monies out of this program, $464 billion, something that most Americans cannot do, something that does not pass the common sense test in Tennessee, and my guess is doesn't pass the common sense test in most states around this country. We're going to take $464 billion out of this program, this entitlement, which is underfunded and insolvent, and we're going to leverage it to create a new entitlement for Americans across this country. And yet we're not going to deal with the issue of the doc fix, which is a $250 billion issue. We're going to kick the can down the road. We're going to cause physicians around this country next year to, if this bill passes, if not, certainly they're going to be dealing with that this year, but we're going to cause physicians around this country another year to be concerned about these huge cuts, not deal with it in this bill, and possibly end up with a $250 billion obligation that could have been dealt with during this health care reform that now is not met, that is going to create additional fiscal burdens to this country and certainly great distress to seniors and physicians who care for seniors. So, Mr. President, again, I have tried to stick with the basic fundamental building blocks of this bill. I don't think anybody in this body has ever heard me focus on some of the more emotional issues. The fact that we would use Medicare monies to create a new entitlement. The fact that we would have an unfunded mandate to states through Medicaid of $25 billion, to me, is problematic. The fact that premiums are actually going to increase, whether it's a CBO number of 10 to 13%, or the Oliver Wyman number in my state, which says 60%, the fact that private premiums are going to go up, and fifthly, the fact that we're using 6 years' worth of cost and 10 years' worth of revenues. Mr. President, I don't know how we've gotten caught up in this debate in such a manner that we are ignoring basic fundamentals that I don't think any of us on our own accord would consider supporting. The fact is that I'm afraid that this again has become nothing but seen as a political victory for the President. And Mr. President, what I hope we will do is step back and do some things in a bipartisan way that will stand the test of time. I ran on health care reform. I'd like to see us do responsible health care reform. The basic fundamentals of this bill do not meet that test. Mr. President, I see that my time has expired. I thank you for the courtesy. I thank the senators on the other side of the aisle that have worked hard to put this bill together. I hope that they will step back away from these flawed fundamentals, and I hope that in some form or fashion we'll put together a bill that will stand the test of time. Thank you, Mr. President.